Joe Cheng, who will be presenting on behalf of our New York chapter, Long Island.
金色事务，各位师兄姐，大家早。Good morning, everybody.
Morning.
My name is Joe Chen. I'm a team director of Long Island branch. With me is Dr. Liao, is a regional medical director. I'm glad I have this opportunity to show you how we're doing for the last year and until today. So in the Long Island region, including Boston, Long Island, Northeast region, including Boston, Long Island, and New York City, TMAS. Okay. So a little bit introduction. Since the last year, we have been doing a couple of outreach. So everything running smooth until the pandemic started. Right? We were attending a forum last year, and we bring back two events. The events keep us very busy, so I'll do some introduction about that too. So during the pandemic, you know, when New York City is a big epicenter, so a lot of people were sick and died, and the medical staff, you know, they lack of the PPE. So during last few months, since the March, we are all doing the distributions and the health educations. So this is my main topic for today. We're talking about a mobile vision. We got a mobile van coming back from last April after the forums, and the two vans serve a lot of schools and at the free clinics. So totally, we have with C2 Success Program, we went to 7 schools so far. The last time we went to the school is until March 4th, which is before the city shut down. So every time we go to the school, we become very welcome, and we're helping many kids. And also the mobile vision, also we're doing that in the free clinics to serve the general populations. So far until shutdown, we have prescribed about over 250 eyeglasses. And one special place, we also serving to the homeless shelters. One of the homeless shelter in Brooklyn to helping the kids there. So mainly for the school and the homeless shelter and the underprivileged communities. So we are planning to do with Ecuadorian communities. We are try to training the Hispanic speech volunteers. And in the near future, we're going to have a community with eye checkup and prescribe eyeglasses. So I want to show you a couple of pictures here. These are the events we've been doing. So this is also including this year. So we went to about 10 events, 10 schools. Yeah, these are the first time, historical day, October 23rd, I've been serving the New York City school first time. We in a car park school in Brooklyn. I was glad I was be able to join. I'm a volunteer driving the vans. So the I-vans now is keep in the Long Island parking lot area. So we try to maintain it, keep it in a good shape. On the right side is ophthalmologist. He's Dr. Zhuang. Yeah, he worked with us and many times already. Yeah, this is another school in the winter during the winter time. Dr. Yang, Dr. Liao, and we have a whole team. We do a lot of volunteer trainings, right? And also the volunteers should go. We go into the school in Wednesday, so everybody gotta take a day off to volunteer to work. this is a homeless shelters also which is in Brooklyn. So we communicate with all the local community leaders. The center one he's from Haiti, so he knew school pretty well. He knew the Tzu Chi pretty well. So we are going to have more cooperation with him. So this is about the vision mobile vehicle. Since last spring until so far, we are planning to do more and for the more school, and also in probably next month, if pandemic is under control, we probably go to the community. We are talking with Hispanic community already, so volunteer training and service will be start soon, hopefully. Okay, so just like the other region, we are doing a lot of medical supply distribution during the COVID-19. We have a distribution team. So we distribute all PPE and masks to medical facilities, also on a medical facility, and under the personal request and internal request. So we go over the medical facility. We are, when the pandemic was pretty bad at that time, Amherst Hospital, probably everybody heard about this hospital. So we, during that time, the hospital, they don't have too much PPE. I was, remember that in March and April, a lot of facility, they lack of PPE. So Tzu Chi try to provide all the stuff, and yeah, and that's a big relief for them. We have a Tzu Chi reaction team. We have a meeting every day to discuss where to go and where to distribute, which lasts about 1 or 2 months. So yeah, totally we distributed about surgical masks, I think of over around 250,000, and also other coverall goggles, KN95. Overall should be over 300,000 items distributed. 40 medical facilities, Long Island, of course, New York City, and Boston. We have 40 medical facilities. There's one of the few examples, Bronx Care Hospital, Harlan Hospitals, and also Amherst Hospitals. Except other than hospitals, we also distribute to a lot of nursing homes. During the pandemic, a lot of residents in nursing homes, they are dying, and so it's pretty bad situation. It's a lot of nursing homes, Long Island, also in New York City, also in Boston. We all distribute all the masks and the PPEs. And also, we also distribute to government facilities and temples. We are giving masks to Buddhist temple, Jewish center, also Muslim mask. Yeah, this is one of the NYPD center office. We distributed. And in the JABIC Center, during that time, the JABIC Center is a conference center and turning into a hospital. So we distribute a lot of masks there too. Yeah, this is CP Association, which is Long Island. I was there, and it's in a beautiful area, but a lot of people, residents were dying there. So we distributing the PPE and the mask. In Boston, also distribute a lot of senior care centers, police office. And we also giving PPE to a personal demand. So like a restaurant and local stuff, and even you can see the post worker. So before the pandemic kind of quiet down a little bit, so the doctor office opened, so we have prepared a clinical reopening box, which is including a mask and K95 and also face shield goggles. So local clinical, they can open, they very appreciate our distributions. So this is regarding the PPE distribution during the pandemic time. Also, so far, the New York City is under control, but a couple of clusters of the positive rates also increased. So we are also prepared for the second wave. So during the pandemic time, we're doing a lot of infection control seminars to educate the brother, sister, and the public to protect ourselves. So before the school shut down, I remember we have a seminars in a Chinese school, Chinese Tzu academies. That's before the school shut down. That time we know infection already started in Asia, but everybody kind of nervous. So infection control classes in the school, and then after everything shut down, we also provide a lot of online service, online seminars, and during that time also provide vegan promotions too, just like the other areas. All right, so that's pretty much this is in the picture shows in the school. Okay, vegan promotion, we have a lot of us nutritionists, doctors, and to give us a vegan promotion and nutrition advice. So the seminar is ongoing now. So we're going to have gradually more seminar coming. So overall, this is a very brief introduction about Northeast region doing for the pandemic area for TMAS. So wish everybody have a nice day and have a successful conference. Thank you.
Thank you very much, Brother Joe, and thank you very much, Dr. Liao, for your presentation. And we certainly appreciate you guys helping us out. I know during the pandemic, a lot of times many chapters have to work together in order to accomplish some of these PPE donations. And when New York first received their N95s, they were very kind to help us out with some shipments. And thank you very much for your presentation. Thank you very much for working with all of us. And